Well, welcome to Something to Talk About. Today I'm really happy to engage a number of nurses on Guam. This is actually Nurses Month, or is it week? It needs to be a year.
Both.
Either way.
It extends, yeah.
Yeah, well, you know what? I think it's every year, every day that somebody who has fallen ill or who is a patient at the hospital or is in need of some kind of care by nurses know that they are the most under-celebrated occupation that I think that we have on Guam. And I am really happy today to be surrounded by them. I think that if anything's going to happen to any of us in King's Restaurant right now, this is the best time for it to happen because we have Mike Gueco. He is from the emergency room at the Guam Memorial Hospital. From the Med Tele unit, we have Jen Toves. And then you have a really interesting job. She's with the adult ICU. This is Olivia Flores Elliott. Do you use all those names? RN.
Still switch.
Yeah, RN. But you know, but we know who they are. I think a lot of people know who you are if they have been in your service. And so thank you for that. Thank you. Thanks, first of all. I say under-celebrated, and I'm pretty sure that you don't want to say because of the humility of the job, right? It's the nature of the job that it requires a lot of patience and humility and compassion. And you are the front lines of medicine. And so I think a lot of people recognize that no matter how bad the situation is at the facility, that the front line is on point. Yeah. And so I guess that's the proud moment that you have, that as long as everything else is, not happening, at least you know that your patients on the one-to-one are getting the top care. Let's start with the emergency room, because the emergency room can turn into a mini clinic for preventative care.
And I think that's what has been happening here particularly in GMH, because I'm not sure if this is unique with our island, but those who cannot afford or who doesn't have a mean to go to their primary doctor, whether or it's their financial status,
Right.
they just go to the emergency department. And sometimes that's where the bottleneck is happening, because that's their only chance of seeing a physician. And of course, that number of patients coming in will keep rising, and of course those people who needs true medical emergency will have to be prioritized. And now with GMH, for about 4 years we have the urgent care department, which have helped our census to go down, because they're taking all those walk-ins that does not necessarily need emergency care.
But some of the problem is that the critical care unit that they can go to has a certain limited amount of hours, right, that they are in operation.
For the urgent care.
Yeah, I'm sorry, urgent care, not critical care, but urgent care. So if you come into the emergency room at 11 o'clock, 12 o'clock, 1 o'clock in the morning, with an ailment that is not necessarily emergent,
Definitely, they will be seen in an emergency department. So what happens is, just like any other emergency department, they will be seen right away if there's no other critical emergency patients inside ER.
So they bump up.
Yes.
But you have priorities, obviously. Yeah.
Definitely.
Like
And
real emergencies versus emergencies that are not as crucial. Or
Exactly, because in the emergency department, unlike in the clinic, they go first come, first served. And sometimes the people does not understand the dynamics of triaging. It means that the triage nurse will have to initially look across the room, check the complaint, and by that skill alone, I would know, do I need to open the trauma room? Because of that initial 30-second one, that's a critical skill by the triage nurse.
That's the most important component of the visit to the ER, is the initial assessment.
Do I need to open the trauma room? Do I need to put
Is
this
it, you mean
patient-
open the trauma room for the person that is
For
a
that
walk-in?
person, yes.
Yeah. But on the other side of it, are you also not dealing with people who don't have a real emergency like that? Come in, they see the triage nurse, they're assessed, and then they're at the back of the line, and then they don't get it because they say, wait, this is an emergency room, I should be seen first. there should be the line should be shorter for people who go to emergency.
That's actually the perception of
Yeah.
most of the people here in Guam. Of course, I understand. We understand them because they're not medical professional.
Right.
If they're having pain, they feel they want it to be seen right away.
Right.
And of course, that's where the communication of the nurses should come in, where they have to be explained. There are a lot of critical patients inside. We have to see them first. And that's where the triage nurse would take their vital signs, making sure they're not critical. And but then again, that's where their feelings of having, oh, I am not important because I'm not being seen right away.
That's one of the areas that is hardest because that's a direct public relations nightmare, right? Because it's people who are in pain and it's difficult to calm them down and to get them into a place where they understand that they will be taken care of based on the symptoms, right? Okay. It's I don't know how much different it is in the medical telemetry unit where Jen, you are there. How long have you been there?
11 years,
Wow.
11 plus years.
Wow.
But it doesn't feel that way because we're constantly busy and nursing is ever changing.
Well, don't you just
it doesn't
because
feel
you
like
love
it's
the
been long.
job that it doesn't feel like
Yeah.
it's sometimes the
Like even the hours that go by, we work 12-hour shifts, but sometimes it'll feel like it's only been 4 hours because we're constantly busy. We're constantly moving and there's so much to do that there's just never enough time in the day to get everything done.
who goes to the med tele unit?
So MedTele, it has to do with, we're a cardiac monitored unit, so we take care of acute care patients that may require cardiac monitoring. So think of your majority population of Guam, your heart attack patients, your stroke patients, acute illnesses that may need cardiac monitoring with infections. So that's our
That's what you do.
area right there.
Is that is that the unit where the majority of patients end up after having been in one of the in ICU or in emergency?
Definitely. I mean, with the emergency room, a lot of them end up, if they're stable enough and don't go to ICU, they're definitely, most of the time end up in telemetry because I think doctors feel too, having a patient cardiac monitored, you know, there's a safety net there that they have 24-hour monitoring even if somebody's not standing right in front of them. And then also when it comes to ICU, we're also the progressive care unit, so we're step-down ICU as well.
Yeah, which is probably an easier place to be. There's less stress and less family involvement on a constant schedule. I mean, as opposed to ICU where things are more critical.
Yeah, well, with ICU being more critical, I mean, we're grateful that we get the step down patients and hopefully we get to see the progress. I mean, sometimes, you know, there's situations where they end up having to be upgraded to ICU because, you know, unfortunately they get progressively more ill. So I get to work with both of them frequently. It feels like
You're the middle guy.
we're the middle guy.
Yeah.
So it feels like in Guam Memorial Hospital, although we are in separate units, it feels like one big family.
Yeah, I
because we
can
all
see
have
that.
To work
you have to
together.
work together. And with you, Livy, you've got one of the toughest jobs there. Well, aside from the NICU, I mean, as far as you know, the monitoring of patients who are gravely ill. Yeah, that's a hard place to be.
Yeah.
You could have gone anywhere.
Yeah. And it's been a hard week, I think, in ICU this week. So we're dealing a lot with trying to explain to families, you know, and decipher that fine line between what is the right thing to do and, you know, that we are doing the utmost things. So, and then letting them decide, you know, what course of action they're going to take as a family
Because,
or patient.
yeah, that's right. Because decisions have to be made based on the care that they're getting at ICU. Well, not the care, but based on the person's status in ICU. So, are there some weeks that are easier than others, or is it
Definitely.
always okay? So, this in particular, without having to divulge all the kind of cases you're dealing with, what makes it different? Why would it be
I
one
think
week
just
from
the
the
flow and then the acuity of the patients. Some are severely sick, and then we get 4 or 5 at a time. We're all just slammed with work, orders, and procedures, everything. So it's
Yeah,
just-
there's a lot going on. Do you think it requires a different kind of character that to be in there? You have to like really drum up some compassion. And is it different on Guam than it might be in other places, in other hospitals?
I think it might be different on Guam because we're basically dealing with every problem that comes our way. In the States, there's trauma ICUs, cardiac ICUs, like you know, they're specific to those units. We just get everything under the sun, and we have to figure it out. So, you know, we do send a lot of patients off island, but we have to stabilize them first. So
Yeah.
that's part of the
That's
issue
the
as well.
that's the issue. Well, we're going to take a break, and honestly, we can bite into our food. Libby's done a great. She's a jam man. She's been jamming it. I told her we could eat, but when we come back, I want to sort of go through each of your stories about what makes a nurse, and there are cultural. There's a cultural element that really makes it a little more difficult because you're dealing with families that expect a lot because the culture prescribes that we have to take that extra step, I think, right? Okay, we'll do that when we come back. We are enjoying it's Nurses, month, I'm going to say, Nurses' Lives. And we've got 3 fine ones from the Guam Memorial Hospital. We'll take a break, we'll eat something, we'll be right back. Welcome to Something to Talk About. We are talking about nursing on Guam, celebrating Guam's nurses with Mike. We got Jen, we have Livia, all from the Guam Memorial Hospital. And I want to go around the table because we're celebrating nurses and the uniqueness of the trade, of the career. And you know, the interesting thing is that Guam has a real vibrant nurses community, that there are a lot of people in the nursing programs between GCC and the University of Guam. This seems to be like a good place on Guam. Is there? Do you think that the school is? I know that you went to San Diego, right? Did you go to San Diego?
No, UOG.
UOG. All three of you went to UOG.
I'm
nursing?
from the Philippines.
Oh.
Okay, and so the UOG nursing program. I mean, it's a celebrated program. I mean, and the nurse of the year, is it not Margaret Hattori?
Yes.
And she teaches there as well. So there's something about the program that has been able to churn out this talent. I wanted to we'll start with you, Liv. What were you thinking? What were you thinking when you said I want to be a nurse?
I just wanted to do something that was going to benefit Guam, and that I wasn't going to be sitting behind a desk to do, like actually physically out there trying to help people. So that's mostly the reason I chose to do this.
Yeah, that has to be a part of it. I mean, you have to want to do something for people, but you could have done, I don't know. There's like other things that, what is it about nursing? Were you scared even to do it because you were dealing with, humanity? That's kind of deep.
I think as I studied and when I became a nurse, my reasons became more clear, because as these guys can attest, like there is nobody in the community, like you were saying earlier in this restaurant, that if something happened, you can't just instill that knowledge and those talents into the people. Like there's no one else that can just pick from the community to place in our position tomorrow that can do our job.
Yeah, true.
Like the things we know and the things we know how to do are from long nights of studying, schooling, and then putting it into action and actually doing it and doing interventions on actual patients. So
Yeah.
I think that's what makes it most important. And
Well, it's an expertise. It's a
Yeah.
trained expertise that not everybody has. So Jen, what's your story? What made you go?
Well, I was a teen mom, and I was sitting in church one day with
What's
my.
a teen mom?
I had a child
Oh, a
early
teen.
on.
I thought you
yeah.
said a teen mom.
I was
Okay.
a teen mom.
It's
I
like
had a
teen
child
mom. Okay.
early in my life, and I gave birth at Guam Memorial Hospital.
Okay.
And I was just sitting in church one day with my mom, and I was looking around, and I told my mom, I said, I think I know what God wants for me, and I think I'm supposed to be a nurse.
Whoa.
Never wanted to be a nurse. Wanted to be a lawyer, wanted to go live in a big city, but I was just sitting there, and I said, I think this is what God wants me to do.
So it was just like something that popped out of nowhere. You never
it
had
did. And-
never tried to studied it, or like, whoa, was a possibility?
Not really. And nobody in my family was a nurse. I mean, we all did food and beverage here in Guam, tourism.
Yeah.
And I just came that I gave birth at GMH. I got to see what the nurses did, and I told my mom, I said, I think this is what I'm supposed to
Amazing.
do. Nursing school was really tough for me, being a single mom and working full time, but I did it, and I didn't think I could, and I'm so glad that I did, because every day is rewarding.
Wow. How about you, Mike? How long ago was this?
I graduated, born and raised in the Philippines, in Quezon City, Philippines. I graduated high school 2002, and that's the time where everybody was just taking up nursing school back there. I was supposed to go to a state university back home, but it wasn't a nursing program. But my grandmother and my mother told me, "Oh, you should take up nursing." So I ended up in the nursing school. In my junior year, that's when I started doing the clinicals back home. That's when I find out. That's when I felt I am really, this is going to be my job. I don't know if it's a calling, but it's what I felt was, this is what I am going to do for the rest of my life. That's my
Wasn't
career.
there, who was the comedian who, is it Joe Coy?
Oh yeah, Joe
Yeah,
the
Joe Coy.
comedian.
Yeah, comedian.
Joe Coy.
And it's true, right?
It is true. It's true.
He became a comedian. His mother said every Filipino man wants to be a nurse.
And I would even joke to the travel nurses that will come to JMH that definitely have met a Filipino nurse. And it is true.
Yeah, yeah.
And so I came here on Guam because of my loving wife, Bridget. She made Guam my
Bridget.
home.
Yay, Bridget.
She made Guam my home. They're Filipinos, been here a long time,
Yeah.
went to school there, met her in college, and Guam is my
the rest
home
is
now.
history.
Yes.
Was there a stigma that you were trying to beat, or is it the same thing in the Philippines where a male nurse, having been descendants of Florence Nightingale, right? That male nursing.
That's true, and with a female-dominated industry, it's
Right.
very hard to have an opportunity to to excel, especially in leadership. And I actually would like to thank Guam Memorial Hospital because last year they gave me a chance to be the OIC, or the interim head nurse, and so I was able to be the head nurse of the emergency department now, overseeing the operations of 55 nurses, 55 staff of ER, and I think it's the trend now is they wanted to bring in more of the male nurses in the management because,
Careful.
I know, right? Yeah. But the hormones, the female hormones, right? Female hormones, and I think bringing in male nurses in the management can bring balance into
I see.
the ideas,
I see.
exchange
Of
of ideas.
a female-heavy organization,
Yes.
a male nurse, but not necessarily male nurses in supervisory positions.
Correct.
Just to sprinkle in there. Yeah, to sprinkle in there and kind of break up the, I get it. Okay. Break up the hormones. Okay. I have to ask you this. When you were going to nursing school, and I don't know at what point in it, but when was it that your grandmother or your mother would ask you for medical advice? Like, hey, can you feel this lump here? And they wanted you to be a doctor and diagnose every ailment. Did you get that a lot? I know your family, so I was wondering whether or not you had the.
Yeah, since I started.
They wanted you to diagnose and give you a prognosis on
Yeah, even up
everything.
to now.
Well, I mean, now that they trust that you have all of these years
Yeah.
under your belt, but are you the family,
I
medical professional?
definitely feel like it. I mean, but when I was going to nursing school, my grandmother didn't want me to be a nurse. She wanted me to be a teacher. I think growing up in Guam, teachers are seen as such a prestigious profession here, and so she was disappointed that I went with nursing until
you
she
started-
had a stroke, and then she was very grateful to have a nurse. And now, of course, family they'll call you for every little thing. And my expertise is not pediatrics. I don't know anything about
Yeah,
pediatrics.
same.
So when they call
Oh,
me
really?
like, "Oh, my baby has a fever or a rash,"
Yeah.
I don't know what
Well,
to
you
say.
must get it because you do that general, emergency care. So you've seen all the ailments and symptoms.
Definitely, we would see from the childbirth to
Yeah.
everything from the dying age. And I think that's where the uniqueness of being an emergency nurse is that this year there were 3 deliveries in the emergency department. So imagine we're not just exclusive
In
to-
the emergency
emergency
room.
department.
Okay.
So we're just very flexible, I should say, when it comes to patient care. And also, I believe that the emergency nurses are also more prone in being exposed to more deaths in the hospital, more suicidal. We've seen.
You
a
see 'em
lot.
all.
We see them all. And here in GMH, 2018, out of 15,000 people we've seen, there's about 170 suicidal patients in Guam. And 30 of them are 30 years old and below.
So you know these stats
Yes.
that they talk about in the government. You could testify that these stats are true and serious. And you know, all of the years that you guys have been working in and out of nursing opportunities in your career, people, and unless you are a patient at GMH and you are under someone's direct care and live to talk about it, every single time people will say that being in GMH was the best care that they could have possibly received. And some of it has to do, I wanted to bring up the culture thing, because we live in a small island and you know people who are coming through these doors. We have a lot of idiosyncrasies that they don't have in other places. And I'm just going to say, just in intensive care, you will have families lined up in the hallway, visiting hours. I'm sure you're constantly having to monitor. And in the emergency room, people cannot stay away. They need to be in the room, or they're trying, and they gather outside in that parking lot like I've never seen before, families coming together. How do you work around that part of your culture and try to stay up with the rules and regulations?
I think that family is a big important part of the holistic care of the patient. And this is something that we have to incorporate regardless if, you know, unless there's a procedure going on, we usually allow family to stay by the patient's side at least, especially I think more so in our unit in their most, you know, in their last days or in their last moments, or in the time that we feel the patient is most critical. We need to ensure the family that this is what we're doing. We're here for you as well as we're here for them. So we try and incorporate it, but we don't let it get in the way of our work.
You have to be sensitive. Sensitive is the same thing to you. It's a little different in your department because you...
Our visiting hours are a little bit more open because the patients are more stable.
Right.
And I think it's important to encourage family involvement. I mean, on Guam, especially of, you know, our Chamorro and Filipino cultures, is family is very important. Especially, I think we show our care when somebody's sick by presence.
Yeah.
Like, okay, Auntie Joe is in the hospital, we all need to go, even if it's for something minor. It can be overwhelming, but I think as long as there's good communication, you know, we encourage family support. So a lot of times the families understand when they have to step out of the room for moments, as long as we're communicating well with them.
Yeah, it's harder in the emergency room because there's a lot of excitement and there's a lot of uncertainty, and people are just scared.
And the culture here in Guam is that they would actually do a picnic outside.
Oh yeah.
They would bring in food. You would see their beach chairs over there, and they would even stay there even
as long as it takes.
Even if we would tell them, oh, you can only visit one at a time every 15 minutes, but they would still be there.
Yeah. And that's, I think that's the key. Well, you guys are always there, and I'm so proud to have you here, and especially because you come from GMH, where the resources are sometimes very difficult, and the ability for you to continue to do your jobs, the way you do your jobs, with the kind of love that you have, I think is admirable, and that's why we're here, to celebrate nurses. Thank you very much for coming, you guys. I hope I never see you.
Yes, not in the ER.
That's like, I will take you here every day, but please, I don't want to see you at GMH, and I hope you don't either. Have a wonderful time, everybody. We'll see you next time on Something to Talk About.